Hi, everyone. We're really excited to be here today. So, my name is Margot Savoy. I'm the Senior Vice President for Education, Inclusiveness, and Physician Wellbeing at the American Academy of Family Physicians. I'm incredibly excited to be joined today with Dr. Todd Shaffer. Todd, why don't you introduce yourself to the people?
Hi, my name is Todd Shaffer. I'm a professor of family medicine at the University of Missouri in Kansas City and a former board member of the AFP. RSV, also known as respiratory syncytial virus, that's a very common respiratory virus that we've had around for a long time. So not something like COVID that's a more recent thing, but RSV has been around since at least the beginning of my training, and I'm sure well before that. It usually creates, some kind of mild cold-like symptoms. Most people recover usually in a week or two, but sometimes it can be more serious for some people, and some people can actually die from it or be hospitalized. And I've had many of those even during this season, actually, that we've actually hospitalized here actually with RSV.
That's a group of people who really is spending time around a kid population, but even if they weren't, they may live in places like nursing homes or other long-term care facilities. They may just have medical conditions that put them at risk for having RSV. And just the idea that like they're already at high risk from some other medical condition or some other issue, and then having RSV could just add to that and make a problem so that they can end up having more hospitalizations, they can have more risk of death. So even as scary as I thought it could be sometimes in kids, it really did surprise me to find out that it was a pretty significant cause of hospitalizations in adults. And so the last number that I heard was somewhere around 60,000 to even as many as 160,000 hospitalizations and 6,000 to 10,000 deaths every year from RSV among adults who are age 65 and older.
There are a couple different RSV vaccinations that have been licensed now by the FDA, and those are for use in adults age 60 and over in the United States. There are two of them. There's the Arexvy, that's a particular vaccination from Glaxo, and then there's also Abrisivo from Pfizer. Both vaccines really contain a part of the RSV virus. They really work by causing your immune response that kind of helps protect you from respiratory disease. So if you're infected with RSV in the future, your body recognizes a lot better, and it's much more likely that you're not going to get as sick or ill or potentially pass it along or have it as long. So Margot, you know about these vaccines? Do you know kind of like how they really do protect the patients, and how many patients are really protected?
So they're actually really good at what they do. So I mean, this is the part that I get excited about. Sometimes patients come in and they're like, yeah, we're gonna get this vaccine, I'm still gonna get sick. But the really exciting thing about this is that, well, number one, they're only a single shot, which, it's kind of cool. So I'm not gonna have to bring you back for 3 shots in the same year. So you get a single shot. For folks who got a single dose, I'm trying to protect them against this sort of symptomatic or like having symptoms in that lower respiratory tract. So age 60 and older, over 80% efficacy. So when we talk about efficacy, we're just talking about how useful it was. So that means that it's pretty darn good is what I'm saying. That makes me really excited, particularly in that first season after they get vaccinated. They're not necessarily telling you that like one is better than the other. Both of them hit pretty good numbers. And so this isn't one of those times where as the patient, you've got to walk in and be like, I absolutely have to have this one or that one. Honestly, what you really want to do is walk in and ask for your RSV vaccine, and then ask if you're due for any other vaccines at the same time, because as you know, your family doc likes to get them all in if they can get them all in. So you want to go in and ask those questions. So if you're a patient who's 60 or older, you can get whichever vaccine's available.
This appears to be a very safe vaccination. It's the first ever vaccination that is approved for RSV by the FDA in the United States. And it's been also recommended by the CDC's Advisory Committee on Immunization as well. And so those are some of the things that we know as very good, rigorous scientific communities that actually review things for us. And that, it is for people that, still need some shared decision making in the whole thing as well too.
Sometimes we think about things as though we're not sick with RSV today. So anything that you do to me is going to be a problem. So if I stick you with a needle, I'm scared of needles. If my arm gets sore, now I'm sore. I may get a fever, I may feel tired. Things that sometimes happen when the vaccine's working, because it's revving up your immune system, makes you not feel that great for a day or two after you've gotten the vaccine. And I think we always have to temper that a little bit with just how not cool the other side of it would have been had you gotten sick. And so it's hard when you're not sick to remember, the lost days of work, the risk of being in the hospital, the chances of actually really not surviving that infection, and how that's weighed against having a sore arm for a day or two. And so really helping in that sort of shared decision-making conversation to weigh out the pros and the cons for that particular patient. sometimes I do wonder, like, what is the best time to get vaccinated? And I think you're right. Like, the vaccine happens, around about the same time as we do our COVID and our influenza vaccine. So in that fall, winter season, because you're trying to prevent the fall and winter things. But remember, you want to do it before the season starts. So ideally, you're doing that in the fall. But to be fair, like, if you happen to have missed it, it doesn't mean it's too late to get it. And so even if if you're watching this video today and you're not really sure, go ahead and offer to go in and see your doc, have a conversation. And I think that they may offer you the vaccine and you should take it.